Good day and welcome to Conversations with AARP in the Virgin Islands. I'm Troy Deshabert-Schuster, State Director of AARP, and I thank you for joining us today. I would like to welcome you to today's conversation with Assistant Commissioner of the Department of Human Services, Michal Rhymer-Browne, and we will be discussing issues of importance to our older population. AARP, a nonprofit, nonpartisan member organization, has been working to promote the health and well-being of Americans 50 plus for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help Americans 50 plus and those caring for them. Almost 2 years later, and the COVID-19 pandemic is still with us and will be for some time. None of us knows what lies ahead with this pandemic. All we can do is keep taking the precautions recommended by healthcare professionals to protect our health and that of our family. Again, today we'll be hearing from Assistant Commissioner Michal Rhymer-Browne about the support services and programs offered by the VI Department of Human Services while navigating the COVID-19 pandemic. Assistant Commissioner Browne, welcome.
Thank you. Good morning, good day, everyone. It's a pleasure to be back with you.
Thank you for being with us again. We always enjoy these conversations with you and your department. You all are like the touchstone department in the government for issues of the older population and provide so many valuable services. And we always appreciate you and your team coming in on our show and sharing that information with the public.
Yes, definitely. It's our pleasure.
Thank you. AARP policy supports and encourages states and jurisdictions across the U.S. to adopt age-friendly policies and plans that will allow residents to successfully age in place. Research has shown that communities that embrace this concept have residents that live healthier and more productive lives. Please share with the public the services and programs offered by the VI Department of Human Services that support those persons who wish to live and age in the territory.
Definitely. This morning, today, I would just want to talk about specifically a program. I usually talk about the Division of Senior Citizens Affairs, but across our department, and I want to talk about a program that is funded financially by the Medicaid and CHIP Services Division. And we know that many of our seniors are eligible for Medicaid and are Medicaid members. Well, one of the areas that seniors tell us that they want support in to be able to stay in their homes for a longer period of time, if they have any type of disabilities or health issues, the need for personal care attendants. And I'm so glad to talk about that we do have now on our state plan, the ability for Medicaid to pay for our personal care attendants to go into the homes of our seniors and persons with disabilities who need that service. Once the physician has included in the discharge plan or the care plan for that senior or person with a disability or even a child who needs those services, Human Services, if you are a Medicaid member, we can refer you to our service providers who provide personal care attendant services and home health services. That is an area that many people may not be aware of, but that is definitely one of the things, a few of the areas we help seniors with in order to live longer in our community.
You know, this is a brilliant program. I've been hearing about it and I've been talking about it, trying to get the word out to the public. We did an entire show on this project not too long ago, late last year. And so many people have a lot of questions about it and lots of interest in it as well. So a personal care attendant.
Yes.
It was my understanding that these people could be like, let's say, a relative or a friend who's already helping you, and they could go and get qualified to be a personal care attendant and then provide that service to you. Is that still the case?
Well, we have those exceptions and variances on the mainland. Now, if someone is a personal care attendant and is certified and has received that training, we would consider. Right now, we're not doing family members, but we are referring to the entities who are Medicaid providers. We have not heretofore, we've just implemented the personal care attendant program in the Virgin Islands. So we're doing a step-by-step. We'll analyze first of our community-based providers and them providing the service. And then we look and take a look at, especially with our funding, if we can open that to family members who may make a decision to provide that service. But currently, they're only the community-based providers who are certified as personal care attendants with Medicaid. Those are the only ones currently who are approved with our Medicaid program.
So I'm assuming that you have a roster of people already
Yes.
certified and approved?
Yes, yes. And how that would be when a Medicaid member, and you don't have to wait for any particular time. If you are interested in this, we have a unit called Special Services, and you can seek those services for yourself if you feel that you need those services. However, it comes with the caveat that your physician would need to have ordered that as a need. When you are assigned to a personal care attendant, there is a requirement for a registered nurse to come and do the assessment in your home with that personal care attendant, and to specifically itemize the aspects of the care plan when that personal care attendant comes into your home. So the personal care attendant may or may not be a certified nurse assistant. However, that is a possibility. You may have a CNA coming in to do those services for you. So Medicaid will pay the certified provider of personal care attendant services for coming to your home. There's an agreement. If it's 4 days a week, 5 days a week, 7 days a week, we will pay by the hour for that service.
And are there limits to it? Could this be, let's say, a full-time position, like 8 hours a day, 5 days a week, indefinitely, or is it?
There are some limits that would be dependent upon the physician's orders. So we will work with the particular member who is a Medicaid member and their physician, because of course we have to have some approval for this to be an assigned service for our Medicaid member, who oftentimes are seniors or persons with disabilities. And for this program, it is not restricted to seniors, but seniors do qualify for this very often.
So the first step then would be for them to, okay, so would the first step then be for them to qualify for Medicaid or go to their doctor
Oh,
first to
definitely.
get the letter?
They need to be a Medicaid member. So
Okay.
if you are a Medicaid member, you speak to your doctor, and a caregiver can help, of course, the member with this, requesting that the doctor in their order or care plan indicate personal care attendant services are needed for this individual. Then at that point, you contact our special services unit. They will identify and share with you the providers who are available to provide that service in each district. And then you are free to contact that provider and set up a visit. However, you must be a Medicaid member. You must have a physician's order indicating that you do require personal care attendant services. And then a nurse will have to visit your home and set up your specific personal care attendant care plan.
And again, going back to another part of my earlier question, are there any limitations? So if the doctor deems that this person needs this care ongoing for 6 months, a year,
Yes.
or until
Yeah,
the
we
end
don't
of the
have a
life,
limitation.
ongoing?
If it needs be, it's ongoing. I know that home health under the Medicare program has specific number of hours that they can do, but the personal care attendant can be an ongoing service.
That's fantastic. That's really, really great news. A huge help to people,
Definitely.
to empower them to live in their home and receive that care at home. That's really fantastic. As the COVID-19 pandemic persists, many service delivery organizations have had to rethink how they deliver support
Oh,
in a
definitely.
time when social distancing restrictions limit in-person interactions. Specifically, those organizations that service the vulnerable populations have had to find creative ways to continue to serve those in need. So, how has the Virgin Islands Department of Human Services shifted their operations to ensure the delivery of critical services continues to meet the needs of the vulnerable populations?
Well, definitely, we have had to adjust and we've been creative. There are some services that you cannot adapt. If you are providing our homemaker services, where you go into the home to clean, to help with baths, to help run errands with activities of daily living, our staff have continued to go face to face with our seniors. However, we have taken all the precautions, the masking, the gowning, the gloves, promoting the vaccination for the client as well as the staff. So we've taken those precautions. So there are some, there's no way to avoid the in-person contact. Our homes for the aged, 24/7 care, no way to avoid the person-to-person contact with our seniors, our vulnerable seniors. However, some of the services, for example, our caregiver program, family caregivers, they usually meet on a weekly basis, face to face, with their support group leader, their counselor. We have had to go to virtual meetings, telephone meetings. We have had to have reduced in-person contact there because we do not want to foster or have the ability for transmission of the virus for the caregivers to return to their vulnerable seniors and transmit the virus. So we have had to adjust there. But our caregiver program, we did have a special evening in December for our seniors in both St. John, St. Thomas, St. John, and St. Croix, where we brought them together, and it was so appreciated. I really commend our caregiver director, Arlene Evans O'Reilly, who really persisted and made sure she followed all of the safety protocols as required by the Department of Health. And in that respect, that was a great success. So we're moving step by step back to more in person. However, we've had to make the adjustments. Our senior centers, they have had to go on pause, but we continue to provide the meals that they would have gotten when they came to the center. We have continued to provide outreach, wellness calls, providing the social, recreational puzzle books, music, compute, and anything to help them stay connected. But it's time to return, and we are pushing for a return at the end of February, early March in both districts. Our St. Croix Center is still finalizing some final repairs. They may be the third center to open, but definitely St. Thomas and St. John should be kicking off in February. Reduced numbers, though, having to come to the centers because of the social distancing.
Fantastic. And I'm so happy to hear that your caregiving program continues. That is so needed. Uh,
So
I, I'm
necessary.
I myself, I'm a caregiver, and I know that the stresses sometimes of being a caregiver. I mean, of course, you love your loved one, and it's always an honor and a pleasure. But at the same time, we're humans, right? And sometimes we get
Exactly.
tired, and sometimes we need support in our work. And I even call caregiving a type of ministry, really.
It is.
It's more than a work; it's a real
It
ministry.
is.
Yeah, it's a
I
work of the
spoke
soul.
about it at our church this Sunday. I actually said, you can't pour from an empty cup. So, in
Right.
order for you to pour from your cup has to be filled. And so, for caregivers, that is particularly important. I remember when my husband, who's now deceased, when I was caregiving for him for 3 years, I had to maintain my social connections, my exercise, trying to maintain myself, my church services, my activities still had to have some form, even though they were reduced, but I could not pour from an empty cup. And so that's where I reached out for personal care attendants and family members to help. And I encourage all family caregivers who are caring for seniors or other loved ones, take time to refill your cup.
That's right. I'm always reminded of the old adage that charity begins at home. You have to take care of yourself in order to
Definitely,
take care of others. Very important.
definitely.
And in this time of the pandemic and all of the controversy, if I may use that term, regarding vaccinations, tell us, how is the Department of Human Services responding to that, especially with your employees who come in contact with the older population on a regular basis? And
Mhm.
also, on the other side of the coin, what are you doing to help the older population to receive the vaccinations?
Well, here at the Department of Human Services, we have almost 700 employees. So what we did, we used our virtual means to have our Department of Health epidemiologists, infection control doctor, other nurses who assist to assist our staff in first understanding what the vaccines are and what they are not. We also shared with the employees, all of our employees, in a mandatory required educational session, and we've had a couple of those. We talked about the possibilities that they can have with the different vaccines, the one dose, the two doses. We talked about the need for personal protection as far as the masking, the washing of hands, how to wash your hands, how often to wash your hands. So we did some education of our own staff. We also, in smaller groups, for our nurses, for our homemakers, we had our Department of Health director, Dr. Ty Hunt, who came in, our medical director, and she came in directly to our homes for the aged to assist them. And I'll tell you, in one of her sessions, we went up probably about 30 or 40% after her direct visit. And Dr. Ty Hunt, I really tip my hat to her because she's convincing and she answers the tough questions and really just challenges our staff. Protect yourself as much as possible. And she shared with them the statistics that those who are vaccinated have much lesser chance of developing serious illnesses and even death. And so those are the things we've done for the staff and ongoing training we're doing there. And then for our seniors, we're doing similarly to reach out to them to talk about safety and prevention. We'll be doing soon in the community some drive-ups that seniors can get the personal protection equipment, the masks, the gloves, even for caregivers. So we want to do that safely, that distribution. So we'll do it in a drive-up type of environment where they go to a parking lot and they just pick up and go. So we'll be doing some of those things for our caregivers, just our seniors in the community, because we take it for granted everyone can afford the gloves and the hand sanitizers. So with our federal funding, we are going to be putting that to help our seniors and caregivers to have all of the personal protection equipment, at least give them to supplement what they have and really increase their ability to protect themselves and their loved ones.
Excellent, excellent. That's so important. And what about for the seniors who will be coming to the senior center and other services that you offer? Are they required to be vaccinated before attending?
Right now, we are pushing for the vaccination. However, we don't have a 100% rule. We have a good number of our seniors who are vaccinated currently who are coming back. We're going to be doing one more round of education and probably with Dr. Ty Hunt coming in to speak to them who are specifically in the senior centers and really promote the vaccination for those who have not been. And we're also, of course, pushing the boosters at this point, because many of our seniors were some of the first to receive the vaccinations early in 2021 and are way past their 6 months right now. So we'll be doing some ongoing education there. And then we'll be setting up our senior centers with the separation similar to the schools where you have the shields between, we sit around tables mostly. So we'll be doing some separation there, distancing the spacing of the tables, really trying to minimize the transmission in the event there is someone who becomes positive, even if they are vaccinated. So we are taking those types of social distancing, added, hand sanitizer, soap, water, access, and then doing a lot of outside activities. That's what we'll be pushing as the seniors come back to our senior centers. Our senior centers, they don't stay inside all the time. They're on the
Right.
go.
Yes, of course. Right. And for AARP, elder abuse is a very serious issue.
Yes.
And we are now working with your department, the Department of Human Services, to develop a very comprehensive piece of legislation to combat elder abuse here in the Virgin Islands. So tell us a little bit of what you all are doing there at the department right now with regard to adult protective services.
Oh, yes. And I always say with crisis comes opportunities. With the crisis of the pandemic, we received American Rescue Plan Act funds, ARPA, and we received monies from the Consolidated Act appropriation under the current administration of President Biden. So one of the requirements of those funding was to enhance and strengthen your policies and procedures for your elder or your adult protective services unit. So we have received and are receiving excellent technical assistance in taking a look at our current laws, our rules, our regulations, our policies, and we are pretty much getting a thorough review of our adult protective services unit. In addition, with working with AARP and our legislature, we will be totally reviewing all aspects of elder and adult prevention, prevention of abuse and neglect and financial exploitation, all of the laws that have anything related to elder abuse prevention and intervention. That is critical because when your laws support the actions of your law enforcement, your social workers at the department, the Justice Department with the attorney generals, and the courts, when you have your laws supporting your actions and your interventions, you are much better able to prevent elder abuse, neglect, and financial exploitation. Last year, we had a wonderful law passed. The financial exploitation law was passed. I think it was 20 or 21, and it really added some teeth in the elder abuse law. And we are now going to do an overview of not only financial exploitation, but every law as it pertains to abuse, neglect, and financial exploitation.
I'm really excited about this bill that we're working on. It is
Yes.
so needed. There's a good bit in the VI code now, but as you know, it's kind of scattered throughout the code. So
It
we're
is.
looking for a bit of a recodification, bringing it together all in one place and closing all of the loopholes. And as you mentioned, especially making it more possible for you all to do good interventions
Exactly.
to stop the elder abuse. And also, we're hoping to get more funding for your department because we know that you have a great team at Adult Protective Services, but they're stretched kind of thin
Very
and
much
they
so.
need some more help.
Yeah.
And so we're hoping to get more funding so you can add more staffing in that area also.
Yes, and we're so appreciative of that. Our staff, one of the things with our ARPA monies, we were able to add at least, I think, 3 staff members. One is on board. We're bringing an additional 2 members on because, of course, the demand for APS has increased during the pandemic. We have individuals, even in this pandemic, financially exploiting our seniors. There are those who are going in and saying, well, I'll go to the bank for you. Give me your account. Give me your coding, or I'll do this for you. and then robbing our seniors of their monies. So we just want to caution our seniors, watch who you give your information to. Even if they're telling you, I'm going to help you with your banking, you don't have to go outside. Watch who you're giving that information to. And we're also educating our banking institutions. We have a wonderful relationship with them, and they make referrals to us after they stop some of the individuals who they see are preying on our seniors. So it's a real big community effort. And I really applaud the banking institution that they make referrals to Adult Protective Services and say, we need to watch this. Mr. So-and-so came in, this person has been coming in, trying to get his money out of his accounts or trying to get their signature on his accounts. And so we applaud our banking institutions for supporting us in the fight against prevention of financial exploitation.
Wonderful. Very glad to hear that. And we're almost out of time. We have just a couple of minutes
I
left,
know.
but please tell us, how can the public learn more about the VI Department of Human Services, all of the services you provide and support systems in place?
Okay, definitely our website is one of the to-go places, and that is www.dhs, our initials, .gov.vi. That is the website, and you can even search it, Google it, Virgin Islands Department of Human Services, and it will pop up. We usually put on our front page updated information about Meals on Wheels, how you can obtain that, homemaker services or pharmaceutical assistance. So you'll see the links there. And also, we keep getting the information out on our Facebook page. We have a very good following on our Facebook pages. We do interviews like this with we're doing today. And we also go on the road on our radio shows because we know our seniors especially love to go listen to their radio. So we still are using radio, we're using social media, we're using in-person presentations, and just everything that we can get. We're even going up on the billboards now that are around the territory so we can spread the information about the availability of services.
Well, good. Well, thank you all so much for all that you do. It's always a pleasure for us here at AARP to work with the Department of Human Services. You and your team are always doing great work. I know that it's always a challenge, sometimes limited resources, oftentimes limited resources, but you all can take those lemons and make wonderful lemonade.
That's right.
Right? So,
That's
so
right.
again, thank you so much for all that you do, and we look forward to having you with us again in a future show.
Thank you so much.
Great. Conversations with AARP in the Virgin Islands. Troy Deshabir-Schuster, State Director, speaking with Michal Rhymer-Browne, the Assistant Commissioner of the Virgin Islands Department of Human Services. Thank you.